Did you know about a disease called Ascariasis, which affects about 2 billion people in the whole world annually and about 820 million people in India per year? It also causes an acute infection requiring hospitalization in people, about 12 million cases per year, and causes more than 20,000 deaths per year. This disease is called Ascariasis and not many people are aware about it. Myself, Dr. Vivek Sharma, working as a senior consultant in internal medicine department at Max Hospital, Shalimar Bagh, Delhi. So what is this disease called Ascariasis we are going to talk about? It is a disease of intestine causing intestinal infection by a worm called Ascaris lumbricoides. So how do we catch this infection called Ascariasis? This is a soil transmitted infection. So a soil which is contaminated by Ascaris worms or its eggs leads to the spread of this disease. Now, this contaminated soil is transmitted through different methods, and there are some risk factors for this disease. What are the risk factors for Ascariasis? There are certain risk factors like improper sanitary hygiene, food hygiene, and improper disposal of the feces and the stools, and open air defecation are the main risk factors for spread of this disease. The disease spreads through contamination of soil by the cysts or the larvae of the Ascaris lumbricoides. So once this infection spreads through the soil or through the contaminated water, how does this affect your body? So once the cysts of this Ascaris enters the body through the ingestion of contaminated soil or water, the eggs, they hatch in the intestines and the larvae are released, and about you'll be surprised to know that about more than 2.5 lakhs eggs per day are released in the stools by these worms, and they hatch into the larvae and they penetrate the intestine and cause problems in the intestines. And when this happens, what all things or problems does the patient have? The patient, you may have problems like vomiting, nausea, pain abdomen or abdominal discomfort, and it may increase to further extents by blocking the intestines. These worms, the adult worms especially, they can increase in the number so much so that they can block the intestine and create a lot of intestinal obstruction, causing a lot of pain in the abdomen. Many times what happens that these larvae even penetrates the intestines and enter the bloodstream and reach the liver and the lungs. Once this reaches the lungs, you may have problems in the lungs leading to cough, asthma, and even sputum production, and many times you may even cough out the worm. So the worms may even coughed out by the patient and you may see the worm in your sputum. This happens many times. Similarly, the worms may be secreted in the stools and you may see the worms floating in the stool. So when this happens and you are having a lot of pain in the abdomen, you are seeing worms in the stools and you are coughing out the worms, this is the time you must visit your doctor and take proper treatment. When are we supposed to meet the doctor when we see the symptoms of Ascariasis? Now, Ascariasis can have long-term complications and many times it has acute complications as well. The long-term complications include anemia, coughing out of worms, sputum production, worms coming out in the stools, pain abdomen and abdominal discomfort. These symptoms can get prolonged and you can see these symptoms many times prolonging over weeks or months, and you are ignoring it. So once you are ignoring these symptoms, which you should not, these can lead to further acute complications, which are sudden obstruction of the intestines. Now this can lead to severe pain in the abdomen and then you have to go to the emergency. So it is better that you are able to recognize the symptoms of Ascariasis beforehand and you don't land up into acute complications of Ascariasis. So any patient who is having prolonged fever, whose cause is otherwise not understandable after many investigations, any patient who is losing weight, a child who is not gaining weight, he is seeing worms in the stools and failure to thrive, so you must consult your doctor and you must inquire about Ascariasis to the doctor. Now, having said this, what are the treatment options and the management of this disease? Now, as far as the treatment is concerned and the prevention of this disease is concerned, there are two aspects. We can have primary prevention or secondary prevention. Now, in primary prevention, we can do proper sanitization of and disposal of the stools in a proper way, and open air defecation should be totally abandoned. Apart from that, you should follow a proper food hygiene, a hand hygiene, and you should impart a good health education in the society. This is the primary prevention. Secondary prevention of Ascariasis can be done by drugs. So in case you are having any symptoms of Ascariasis, as we have discussed, you can talk to your doctor and he will be prescribing some medicines for your disease. The World Health Organization has been very active in prevention of this disease and has been running many programs, and one of the programs in which the World Health Organization recommends the use of certain drugs for deworming in the society. So mass deworming is what is recommended by the World Health Organization, especially in the areas in which it is endemic. So in case there are populations in which it is endemic, more than 20% of the people are affected and it is endemic, so you can do periodic deworming once a year. In case it is more than 30% of the population is affected, you can deworm twice a year. And the aim of this deworming in the society is to prevent and decrease the morbidity due to Ascariasis in children. In the end, I would like to say the bottom line that in case you are having symptoms of Ascariasis, try to catch it early. So in case you are having a low grade fever, your child is having pain in the stomach and he is having vomiting repeatedly, so it is better to visit doctor at an early stage to prevent the acute complications of Ascariasis at a later date. Thank you so much.